Hello and welcome to our listeners from around the world. This is JAMA Network Open Conversations. I'm Angel Desai, Associate Editor for JAMA Network Open. Today we are speaking with Dr. Jennifer Head about association of COVID-19 incidents with age eligibility for elementary school in California. Welcome. To begin, can you please introduce yourself?
Thanks for having me. I'm Dr. Jennifer Head. I'm an assistant professor of epidemiology at the University of Michigan.
So this was a really interesting study, and as you state in the paper, the association of SARS-CoV-2 and school attendance was a really important question that emerged during the pandemic, and arguably one that we continue to see the downstream effects of. With that in mind, can you give us a bit about the background of the study?
Absolutely. So this was a study that we conducted in part because we wanted to understand better the association between school attendance and COVID-19 outcomes in children, but also because we wanted to develop new methods for addressing this question. As we saw in the pandemic, a lot of the early decisions to close schools were based off of evidence from past infections, such as influenza, which does disproportionately affect children. And so we needed more evidence going forward in order to inform school closures in the face of novel viral infections. And some of the epidemiologic methods to do so can be limited in terms of making quick decisions. So cohort studies are really phenomenal, but they take a lot of time and they are hard to conduct in pediatric populations. There were other ecological studies that were done that compared rates of COVID before and after school closures, but those types of studies required data to be collected and observational experimentation of having the schools open and then closed in order to get an effect estimate out. So we wanted to test out this study design called regression discontinuity design to see if we could understand the effects of school eligibility and school attendance on COVID-19 and using methods that were potentially more rapid and had lower barriers to conduct for state health departments.
That's fantastic. With this in mind, can you give us a brief overview of what you did in the study?
Yeah, absolutely. So as I mentioned, we used what's called a regression discontinuity design, which is essentially comparing the outcome across some discontinuous jump as a continuous variable crosses a threshold. So in this instance, we were looking at age of children. Age is a variable that is easily collected in surveillance records. And so we had information on the age of a child. And because in most states, a child is eligible to attend kindergarten if they're born before September 1st of a given year, we could tell whether the child present in the surveillance record was eligible to attend kindergarten. So we use this regression discontinuity design to compare rates of COVID-19 incidence and hospitalization among children who were born just in time to attend school and then just missed that eligibility threshold and could not attend school.
And what did you find?
Yeah, so what we found was pretty interesting. So we first started by comparing rates of incidence and hospitalization in the periods of time when schools were closed as a negative control, under the assumption that we shouldn't see any differences in the children who are eligible versus ineligible to attend school. And we did confirm that when schools were closed in California for in-person instruction, we didn't see any association between COVID-19 outcomes and eligibility to attend school. When schools did reopen for in-person instruction, which occurred in California in the fall of 2021, we saw a jump in COVID-19 incidence of about 52%. So COVID-19 incidence was 52% higher among children who were eligible to attend school as compared to children who were ineligible to attend school, in this case, school being kindergarten. But we saw that this association declined with each additional in-person semester. So by the next semester, which was the spring of 2022, the children who were eligible to attend kindergarten had 26% higher incidence of infection. And then by the following fall, which was the fall of 2022, the children who were eligible to attend school had 19% higher incidence of infection as compared to the children who were not eligible to attend school. And interestingly, we also saw that children who were eligible to attend school had lower COVID-19 incidence over that summer break as compared to the children who had not perhaps been eligible to attend school, potentially because the children who had been eligible to attend school had acquired more immunity than their counterparts who were not attending kindergarten at that time. We also were able to look at associations between hospitalization and eligibility for school attendance. And for those analyses, we did not see any effects. And we also compared the strength of the association between age eligibility for school and COVID-19 incidence across counties to try to understand whether certain county level variables might explain why some counties had strong associations between age eligibility for school and COVID-19 incidence. And what we found there was that bigger counties tended to have weaker associations between school eligibility and school attendance. And we don't exactly know the reason for this, but we think it could be due to the fact that larger counties tended to have stronger mask mandates in place, or larger counties we know had higher COVID-19 circulation in general. So it could be that the children had higher levels of immunity by the time they were eligible to attend school, or by the time the school reopened for in-person instruction.
So interesting. A lot of really great insights from this paper. I'm wondering, and I think you mentioned it in the text as well, but were you able to take into account things like vaccination rates over time, or even just changes, right, over time, specifically as it related to the pandemic and policies?
Yeah, so we did examine vaccination rates as a county level variable to see whether or not counties that had higher vaccination rates had different associations between school eligibility and COVID-19 incidence. And we did see that the counties that had higher vaccination, both in adults and children, did have weaker associations. We did, as I mentioned, see that attenuation of the association between school eligibility and COVID-19 incidence over time. And so one explanation for this could be that children were acquiring immunity, at least the school children were acquiring immunity. And this could have been because they were eligible for vaccination, or because they had acquired immunity through natural infection.
That makes sense. We've talked a little bit now about the use of regression discontinuity design as an important method, particularly in the context of this type of work. And I wonder if you could speak perhaps more broadly to how this type of design could be used for other questions related to infectious disease epidemiology.
Yeah, so the regression discontinuity design is a quasi-experimental design, and it's similar to an instrumental variable analysis in which you have a continuous variable, and whether or not that continuous variable is greater than or less than a threshold has an effect on the probability of somebody experiencing an exposure of interest. And so here we're interested in the age of a child, and whether or not that child is born before or after September 1st will strongly influence whether or not they attend school, because it directly influences their eligibility. And so we make the assumption that children who are born just after the school eligibility threshold are similar to children born just before the threshold on a variety of factors that are related to COVID-19 outcomes, except their probability of school attendance. And so if we then look at the outcome of interest and look at how it changes as age crosses this threshold, we can start to attribute gaps or jumps in the outcome of interest to the effect of the exposure of interest. So this sort of regression discontinuity design is not new to understanding the association between school attendance and a variety of health outcomes. It's actually quite commonly used, particularly in the econometrics world, to look at associations between school attendance and lifetime earnings, mental health, obesity, mental health disorders later on in life. But it has not been used to understand the association between school attendance and infectious disease outcomes. And so I think this paper is a great example of how this approach could work in that field. It was a bit challenging in this context for COVID-19 because we do know that one of the important features of the COVID-19 response and the school opening approach in California was case acquisition and surveillance testing among schooled populations. So in this case, we were actually challenged to try to adjust for differential case ascertainment among schooled population compared to unschooled populations. But other infectious diseases would be less challenged by this differential case ascertainment because schools do not commonly have those surveillance programs set up. So I think this method could be really readily applied to understand association between school attendance and various influenza viruses or RSV virus, etc.
That's great. I think this study, as I said, was such a great piece to read, and also I think has so many important public health implications. And so before we wrap up, I just wanted to give you a chance if there were any other final thoughts regarding this topic.
Well, I think what excited me about this study is that we were able to achieve what I believe are robust associations using surveillance data. Surveillance data is collected by every state health department in our country, and so it represents a readily accessible form of data, but it can be challenging to draw associations from because it is case-only data. So what was exciting to me about this study was being able to bring a study design that has yet to be used within this context and bring it together with a robust surveillance system to try to understand a question of extreme importance.
I think that's a fantastic thought to end on. Thank you so much for speaking with me today about this really important topic, particularly as we make our way through the fall as kids are back to school. I'm Dr. Angel Desai and have been speaking with Dr. Jennifer Head about association of COVID-19 incidents with age eligibility for elementary school in California. You can find a link to the article in this episode's description. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.